look at a card, and I'm going to ask you then to remember that card, if you will. And as we go through, you can look at one card and remember, if that's okay. Hand you the deck, and I'm going to ask you, please, just take the deck, lift up, look at one card, and then drop the deck back down. You've got your card?
Yeah.
I'm going to ask you, please, to remember that card. I'll have you stand up, if you will, and I'll take the deck back, and I will ask you, please, to do the same. I'll have you just crack the deck open, look at a card, remember it, and then stand up. Got it? Very good. Thank you. I ask you to do the same. I'll just have you look at a card, crack it open, remember it, and then I'll ask you to stand up. Thank you. I will come over here. May I ask you, please, just to look at a card, then rise up before time it in these days. Thank you. Deck of cards. We have several people standing with cards. Dr. Cleaver selected a card at random from the shuffled deck. Now I'm going to ask you all, please, to concentrate on your cards. And I'm even going to ask, if I may, I will have, and I appreciate this, Lynn is actually filming for us today, and I may have you sweep our audience so that you can see who all is standing with the card. And now, I don't want you to do anything yet. In a moment, I am going to name 4 cards. Don't do anything, please, until I'm done. I want you all to picture your cards, because this is something that we do as well. When patients present to us, we picture them. We see their gait, how they walk. We observe skin for pallor, for rubor. We look for what our patients show us. And we also gain a sense, as osteopathic physicians, of a connection with our patients. And today I'm gaining a connection mentally with you all, as if cranial sacral at a distance. Because I am seeing 3 of clubs, 5 of diamonds, a queen of hearts, and an 8 of spades. If I named your card, please sit down. Thank you. One card I didn't name yet. From a shuffled deck, Dr. Cleaver selected a card at random. What we are going to detail now, because we're giving a talk on legal issues, is it is so very important in practicing medicine that we have one of these, an insurance policy. And it's important to have an insurance policy that covers the scope of our practice. Now, I have a policy, the magician's insurance policy. The most common document in the United States, the most common contract entered into is the insurance contract. The least often read document in the United States is the insurance contract. So please, when we look at the policy here, I'm looking to see the conditions of my policy. Please be certain that you have read the conditions of your insurance policy to be certain that it covers your practice. Condition number 1, all parties involved must be dealing with a full debt. Hopefully we are. Number 2, when uncertain, look to the policy itself. You see, I'm going to show you that my policy shows a card. Dr. Cleaver, would you please show us the playing card that you selected at random, and what is your card? Thank you.
Thank you.
Yes, it is so important that our insurance policies cover our practice. Books. I brought several books with me today. Case of Intuition. This book reminds us that as osteopathic physicians, we should rely on our intuition. You see, we are especially schooled in sensing and feeling changes in tissue texture. We are especially skilled in feeling changes in rotation in the spinal area. We're able to feel the tissues in cranial sacrum. We're able to tell when there are changes that are occurring. The ultimate flashback, when Dr. Phelps spoke today about concussion and the injury to brain tissue, we have to remember that post-traumatic stress disorder, one of the keys is flashbacks. And as well, when we were having our infectious disease lecture talking about using the methyl and its potential to create brain lesions that will lead to symptoms similar to post-traumatic stress disorder. Death Wish reminds us that when we're looking at psychiatric illnesses, 10 to 15% of patients with major depressive disorder will succumb to suicide. In bipolar disorder, 1 out of 2 patients will attempt suicide at least once. In schizophrenia, 1 to 2 patients will attempt suicide at least once. So it's important for us to remember issues of suicide. The Del Shannon Mysteries reminds us that so much of what we do in medicine is still a mystery. And Webster's Dictionary reminds us that when we are obtaining informed consent from patients, we want to do so in language that our patients understand. Now, if I may I hand you, please, Chuck, I'm going to hand you that book, Case of Intuition. I'm going to ask you, please, if you will, tell us how many pages are in that book. Okay. Yes, to the back, there are 267 pages. If you allow me the poetic license to say 300 pages, there are approximately 200 to 400 words per page, approximately 100,000 words. Chuck, I'm going to ask you, please, if you will, just to read through the book. I want you to turn to any page you want. And once you've found that page, I'm going to ask you to silently scan down that page for a word. For today's purposes, I'm going to ask you, please, to select the biggest word, the longest word, the most letters, the most syllables, because that will make this the most impressive. And I want you to silently find that word, or if you're conflicted between 2 words, you may select 2, and after you've done so, please, I want you to commit them to memory. You may show them to your colleague, to your right, if you want, so that you both are literally on the same page. And then I'll take the book back. Appreciate that, please. Remember your word or words. And if I may, I'm going to ask, please, if I may, Phil, I just want you to say stop at any page. Stop. Very good. I'm going to ask you, please, to look at the first word at the top of that page and just remember that word. I'm going to ask you to look at the 2 page numbers at the bottom, so you know those 2 pages. Yes? I'm going to hand you the dictionary, and in a moment I'm going to ask you, please, to turn to the 2 pages in your dictionary. We have several words at play here today. You've turned in the dictionary. There should be 4 columns of defined words. Chuck, are you thinking of 1 or 2 words?
1 word.
1 word. Now I'm going to ask you, please, not to tell us your word. I'm going to ask you just to share the first letter of your word out loud with all present.
I.
The letter I. The letter I in and of itself doesn't tell us a whole lot unless we're an ophthalmologist. The first time we see a patient in our practice, we get a letter. Indeed, that is the metaphor for the first day of information. The second time they present to us, we get more information. The information we get may be an L. The next time they present, maybe another L. Maybe a U, maybe an S. You see, the unconscious mind goes to a word that has meaning. And Chuck has selected a word that reminds us that every time we see the patient, we're getting a picture. And that picture is actually, Chuck, an illustration. Is that correct? Is that the word we selected?
He looked at it also.
Very good. Thank you. Now, Phil selected a word that has meaning also. When we are treating patients, it is not them and us. We are now a team. And so as we engage in that journey of treatment, the patient, the physician, we go A-L-O-N-G along that road together. Is that correct?
Yes, it is.
Thank you. 2 pages were selected at random. You turn to those 2 pages in your dictionary. Is that correct? There are 4 columns of defined words. Is that accurate?
Yes.
Now I'm going to ask, would you like column 1, 2, 3, or 4? 4. 4. I'm going to ask you please to look at column 4 at the first bold print defined word at the top of the page, the column. And it reminds us, you're looking at a word, and your colleague next to you, Chuck, you can see it if you want to. You're looking at a word that reminds us, when we are talking with patients, we as physicians, we don't cast our own judgment onto patients. We are there to be there to treat them and to help them. And we don't want to become alarmed or aghast or show that if our patients use language that is E-A-R-T-H-Y. Is that correct?
Yep.
Thank you. Thank you. If we have just 2 more minutes, we as physicians today, because of reimbursements, become concerned. And so I thought I would do my last effect for us with money. Yes. I have $30 in my wallet, $31 bills. I wanted to have enough for tips and other various and sundry things. May I hand you these $1 bills face down? I'm going to ask you just to mix them however you want. I know you have a casket, so if you can, I just want you to shuffle them up. Okay, just shuffle them up so they're totally and thoroughly mixed without looking. I don't want to see the bills. And now what I'm going to do, I have another set of dollar bills, $15 to be exact. You can count them if you want. I'm going to ask you please to shuffle those up face down. And then I'm going to have you, after you've shuffled them up and you're satisfied they're thoroughly mixed, I'm going to ask you please to just select out one of those dollar bills. I don't want to see it. Keep it face down so I can't see the face of it. And I will take the rest of them back. This is very good. We're being excellent, very selective. I will take these back without looking at them. Thank you. So that leaves now 14 bills. I'm going to have you do the same if you will. Just take one. I'll take 14 bills back. So now I'm going to take the 28 bills and put them back in my wallet. You each have a bill, a single bill. Is that correct?
Yes.
Okay, very good. Face down. Second thought, let's use the 28 bills we have left. May I hand you both these $28 bills? Please shuffle them face down, and then I'm going to ask you all to select one bill. I'll take the rest of them back. Perfect. Thank you. $28 bills. We're now down to 27. What makes humans unique is our fingerprints. No 2 fingerprints are alike. Dollar bills. No 2 serial numbers are alike. We've passed out 3 $1 bills. I'm going to ask you all now, please, to look at your dollar bills. I don't want to see them. Those around you may gather to look at them as well. Each dollar bill on American currency has a letter at the beginning, a letter at the end, and a series of numbers in between. I want you to look at your dollar bills because I'm getting the following impression. You selected a dollar bill at random, am I right? After you shuffled all those dollar bills, and I see in your mind's eye that dollar bill that you're looking at starts with the letter A.
Yes.
Yes. And then it has the following numbers that are running through your mind right now. 0608. 1949G. Is that correct?
Correct.
Thank you. You're looking at a dollar bill. Yours starts with a D.
That's correct.
And it goes 083-11951, and it ends with a G. Is that correct?
That's correct.
I want you both, please, to concentrate on your dollar bill because I'm getting the impression, and this is what we do osteopathically every day with our patients. We get an impression of their health, the appropriate treatment approach. And I'm seeing a G as your first letter. A G. 103-01922 E. Is that correct?
That's correct.
Thank you all very, very much.